And like I mentioned, this PowerPoint is on addictions. For those of you who don't know, the Canadian Mental Health Association nationally has been around since 1918, so we're over 100 years old, and we're quite proud of it. We've been helping Canadians maintain and improve their mental health for over 100 years, so that's pretty awesome. We're the provincial-wide leader and champion for mental health, and we help people access community resources that they need to build resilience and to support their recovery from mental illness. So we're there to support, advocate, educate, do everything that we can do to support New Brunswickers in any format that we can. So yeah, that's what it's all about. So CMHA of New Brunswick has 18 locations provincially. We have, of those, 3 offices. There's one in Fredericton, Moncton, and St. John. Fredericton is our provincial office for obvious reasons. And then the other 15 locations are a work program, employment program, Working Stronger Together, down in Charlotte County. And the rest are the CECs, the Community Education Coordinators, of which I am one of quite a few in the province. So we cover all the rural areas of the province, we cover all the province except for Fredericton, Moncton, St. John. Those greater areas are covered by those 3 offices, and then the CECs do all the rest. So no matter where you are in the province, we got you covered. So you just need to reach out and let us know. And then, of course, we have a provincial peer support program that's being run out of the Fredericton office, provincial office, and those peers are with the FACT teams throughout the province. So, so we have that peer support. So, okay, so let's look at a few statistics. 21% of Canadians, about 6 million people, will meet the criteria for addiction in their lifetime. So that's a lot. That's 1 out of every 5. 8% of all Canadian hospitalizations are directly attributable to addiction. Canada loses $11.8 billion per year due to illegal substance use. And Canada has one of the highest rates of cannabis use in the world. Well, that's probably more true now than ever that it's been legalized in Canada. So, what is addiction? Well, when we're talking about addictions, okay, well, how about you guys? Does anybody have any ideas of what they think addictions might be? Anybody have any ideas? Well, it can be a hard question to answer as, okay, there we go. We can say substance use disorder, yes. An overindulgence or dependence on a substance or behavior. Exactly. I think it's almost a compulsive behavior or habit. It could be a lot of things. Well, there you go. We'll get lots of comments coming in. Anything that you overindulge in. Okay, perfect. So let's move on. So it becomes important to ask ourselves then, what exactly is an addiction? This can be a hard question to answer as addiction is very complex. It can be described as a complex mental health issue that interferes with one's life. It involves the compulsive use of a substance or a compulsive behavior that is not stopped despite of the negative outcomes that accompany it. So it can be important to note that addiction, substance related, is not purely caused by the substances themselves, but rather by the lived experiences of those who become addicted. Because of this, it is a long-term illness. These individuals feel an overwhelming need to give in to their cravings and addiction, typically because they have lost control of one of their own actions. Like mental illness, addiction is something that can affect anyone, despite your income, your family upbringing, your education, your culture, or your physical ability. So when talking about addiction, I think it's important to distinguish between 2 related concepts, substance use and substance abuse, which is another term for addiction. Substance use involves the consumption of drugs or alcohol or participating in a potentially addictive behavior, such as gambling or shopping, without problematic outcomes. This means that these individuals have the capability of stopping themselves from engaging in these behaviors, but there are negative outcomes or long-term impacts. Substance abuse, on the other hand, ensues when one feels that they are at the mercy of their addiction and cannot stop engaging in the behavior, even when there are negative outcomes. As you can see, substance use and substance abuse can therefore be considered to be on a spectrum. So when we talk about a spectrum, what might that look like? So, oh, well, there you go. So addiction is a very complex mental health problem that interferes with one's life. It is defined as a compulsive engagement with a substance or behavior, despite the negative outcomes. And this is a long-term illness where people feel an overwhelming need to give in to the addiction despite the consequences. It can affect anybody. So the spectrum of substance use and addiction. So we have up here the beneficial use. It's a use that has positive health, social, or spiritual effects. Example, medical, psychopharmaceuticals, coffee, tea to increase alertness, moderate consumption of red wine, or sacramental use of, and I cannot say those two words, peyote, I think is the last one, but that first one I struggle with. Casual and non-problematic use is recreational, casual, or other use that has negligible health or social effects. Now we get into the problematic use. Use that begins to have negative consequences for the individual, family and friends, or society. So an example would be impaired driving, binge consumption, harmful routes of administration. And then last is the chronic dependence. Use that has become habitual and compulsive despite negative health and social effects. So, spotting addiction. Addiction can be spotted using the 4 C's approach: compulsion, craving, loss of control, and continued use despite the consequences. So with compulsion, this describes how these individuals are driven to use their substance by an overwhelming feeling to do so. This compulsion can be something someone who is experiencing an addiction is not able to fight off. Second, we see the craving. Those who are addicted actually crave the substance that they use because their body becomes physically dependent on it to operate. Without the substance, these individuals can go into withdrawal. So to avoid that, they must use the substance. Thirdly, we see the loss of control. This can represent either a loss of control in the frequency with which the substance is taken or with the amount of substance that is taken. Either way, it depicts an increased usage, which is problematic, and reduction in control of outcomes. Finally, and probably the most obvious, is a continued use of substance despite the negative consequences. Individuals experiencing an addiction are unable to control their compulsions, cravings, and use, and can therefore be taken over by their addiction. This causes them to continue to use regardless of the negative impacts to themselves, their loved ones, or their community. So, symptoms of addiction. Symptoms of addiction are, for an example, a loss of interest in the things that they used to enjoy, rapid mood cycles that can be really unpredictable, and reduced emotional regulation, increased impulsivity and risk-taking, beginning to notice significant problems in the home, work, or school life, changes to the individual's weight, sleeping habits, or eating habits. The individual begins to become more secret and prefers to spend their time alone. And with denial, often those living with an addiction are in a state of denial that they have a problem. While this can be one of the most frustrating parts of addiction, it is important to remember that these people are suffering an illness and cannot always spot the problem themselves. So, then what are the risk factors of addiction? Well, the risk factors that puts you at the greatest chance of developing an addiction is genetics. That's having a family history of individuals who had similar issues. You are actually 6 times more likely to develop an addiction if you have a blood relative who has experienced an addiction too. There are several other risk factors that make you vulnerable to addiction, and no factor will elevate your risk or No factor will elevate your risk of disease higher than another, but they can affect the likelihood and speed at which you develop the addiction. So having a mental illness puts you at an increased risk of using and abusing substances. A high level of stress can put you at risk. If your use of a substance began at a younger age, you are at an increased risk of that use becoming problematic. Statistics of prevalence indicate that males are twice as likely as women to develop problematic substance use. Having a poor home life can be an issue as well. Young individuals without a strong attachment to their siblings or parents are at a heightened risk of suffering addiction one day. The more risk factors that a person has, the greater chance that they're going to develop an addiction. So, types of addiction. We have a couple of types. We have substance-related, so the problematic use of a substance, and it includes drugs and alcohol. Behavior-related, it's the problematic continuation of a behavior. Includes addictions such as binge eating, shopping, gambling, sex, electronics, and exercise. So, that is looking at the different types of addiction. But before we get into some specific types, I feel it's important to highlight the fact that there are 2 really broad categories of addiction, and those are what they are. So the first one, substance related, this type of addiction involves the use of alcohol or drugs and tends to be the type that we most commonly think of when we're discussing the issue. The second one, however, is a behavioral type, and it's the type of addiction is seen when an individual performs a behavior in a problematic way. Some well-known forms of this type of addiction include things like the gambling, sex, shopping, and even exercise. Okay? So, next. So, common substances of misuse in Canada. What do you believe are the 4 most common of misuse? Definitely alcohol, cannabis, tobacco, and prescription drugs. Those are the 4 that we're dealing with the most. The 4 most common substances of misuse are, and while there's a large list of substances and behaviors that one can become addicted to, today we're going to narrow in on those most problematic in the Canadian society. So, alcohol addiction. Let's begin there. Alcohol is the most common substance used in Canada. Canadians spend $14.6 billion per year on alcohol-related harms. In 2015, 44% of students in grades 7 to 12 reported alcohol use in New Brunswick. That's pretty well half. Can lead to negative side effects including memory loss, violence, mental health issues, and the increased risk of cancer. So, that's a lot. When we look at those kinds of statistics, that's a lot. The one that really shook me, I guess, was the one of the students. It says the average age that one starts using alcohol is 13 and a half years old. And I find that shocking. I'm not going to say my eyes are closed. I must say that I haven't been faced with that before. And, when you stop and think of it, it's a scary statistic, and it just shows how important it can be to educate our young on the effects of such substances. I don't think we can ever start early enough. I think it's also important for us to examine the issue in terms of New Brunswickers as well. In New Brunswick, alcohol is the most commonly used substance by middle school and high school youth alike. In St. John in 2015, 44% of students in grades 7 and 12 reported alcohol use in the past year, which was higher than the national average of only 39.5%. So while we discuss alcohol use on a national scale, there's something impacting the youth in our own communities, right here at home. So it's important, I think, that we, pay attention to that. So next we move on to cannabis, also known as marijuana or weed. This is the second most commonly used drug by Canadians, and an important drug to highlight given the recent changes in our country regarding its legalization. There can be different methods of cannabis use. While many of us consider smoking as the primary source, cannabis can also be taken as a liquid known as cannabidiol or CBD oil. This form of the substance can have therapeutic effects and contains no THC, the ingredient that makes you experience the high of the substance. Instead, this form of cannabis binds to the receptors in your brain to help alleviate pain and neurological symptoms. In fact, CBD oil is commonly used in epileptic children as part of their treatment. Today, however, when we discuss cannabis, we'll focus on the forms that do include THC and thus have a more addictive nature. Canada currently has the second highest rate of cannabis use worldwide, falling only behind the United States. In 2017 alone, Canadians spent an estimated $5.7 billion on medical and non-medical cannabis. The average age within which a person might first begin to use cannabis is 14.2 years old, slightly older than alcohol, but still alarmingly young, and the most common means of obtaining this substance has been reported to be family and friends. So according to Health Canada, 9% of adults and 17% of youth who frequently use cannabis will develop an addiction to this substance. With rates of usage so common in our youth population, we need to be sure that they are aware of the potential consequences of their actions. Overall, cannabis can lead to a variety of problems, including memory loss, a distortion or unawareness of time, body tremors, increased heart rate, and blood pressure. The next one is tobacco addiction. So, while smoking might not immediately come to one's mind when the topic of addiction comes up, it's the most widely used addictive substance that exists, and in Canada, it is directly responsible for just over 17% of all reported deaths. As much awareness as there is on the topic, a reported 5 million Canadians still regularly smoke today. A 2012 New Brunswick Department of Public Health report noted that 21.6% of all New Brunswick youth in grades 7 to 12 currently smoked tobacco. And interestingly, St. John reported the highest rate of smoking in all of New Brunswick for that age bracket. While smoking is a highly publicized issue, it is still important to go over some risks. Regular smoking can increase your risk of heart disease, ear and sinus infections, and strokes. It can also make you more susceptible to colds and flus, cause digestive issues, or lead to lung cancer. And then last but not least, prescription drug addiction. Finally, we're going to examine the non-prescription use of prescription drugs in Canada. Canada is the 4th highest user of prescription narcotics in the world. This category of drugs includes both painkillers and sedatives. Painkillers are known by a variety of names, including but not limited to Percocet, Tylenol 3, methadone, fentanyl, and oxycodone. While these drugs are often prescribed by healthcare professionals to manage pain, many individuals take these without being prescribed. While addictions can develop with or without a prescription, in 2017 it was reported that 13% of Canadians use these substances without a prescription. That's quite high. Sedatives are commonly prescribed to help people sleep or to reduce their anxiety. The most commonly known include Xanax, Valium, and Ativan. The rate of antidepressant and anti-anxiety medication use has been growing in Canada over the past 10 years. In 2017, a report from New Brunswick was listed as the province with the highest use of anti-anxiety medications, with a rate of 7.7% higher than the national average. As of 2015, there are an average of 13 hospitalizations a day across the country that are directly related to non-prescription use of prescription drugs. That's pretty substantial. All right, so how do addictions begin? Well, people enjoy the physical and psychological changes they experience with a drug or behavior. This encourages them to obtain that experience again, and once this becomes a habit, it can be very difficult to stop. Sometimes these events can encourage addiction. There are events that can encourage addiction: curiosity, impulsivity, increased stress, trauma, mental illness, and social impacts. Addiction is unique to each and every individual and can happen for a variety of reasons. What can be a harmless use of a substance for one may turn into a dangerous use for another. This makes addiction unique to the individual themselves and sometimes confusing for those trying to understand how a loved one came to have this issue. One thing that we do know, however, is that addiction is commonly linked to several other issues, including mental health issues, stress, anxiety, and depression. So we'll explore those links briefly now. So, mental illness and addiction. A major health concern in Canada is the co-occurrence of mental health issues and addictions. Those with a mental illness are twice as likely to experience addiction. This is especially important for vulnerable populations, including those who are homeless, poor, or LGBTQ. So, individuals at times use the substances at first to self-medicate in an attempt to either treat or alleviate some of their symptoms of their mental illness. Somewhere along the line, however, this use may become problematic. Stress and addiction. Stress is another factor that's been linked to addiction. Research has found that the onset of stressful life events can lead individuals to increase their substance use, which may develop into addiction down the road. Some instances that increase one's stress include abuse, natural disasters, financial hardships, or even being the victim of a criminal attack. The people who experience these stressful life events may turn to substances to alleviate the emotional pain that they're feeling. This can lead to a dangerous cycle, however, where stress leads to the use of a substance which then reignites the emotions about a stressful event and causes even more self-medication. So once established, this cycle can be hard to break and can lead to negative outcomes. There can be a strong connection between trauma and addiction. Okay, anxiety and addiction. Oh, I forgot to move the screen forward. There we go. Anxiety is another factor that has been linked to addiction. The biggest issue here is when an individual self-medicates to try and alleviate some of the hardships that they're feeling due to their anxiety. These individuals are 3 times more likely to become addicted to stimulants, which are drugs commonly known as uppers, that temporarily increase alertness and energy levels. and 5 times more likely to become addicted to prescription drugs that are intended to alleviate anxiety, such as Xanax and Valium. Depression and addiction. Depression is another issue commonly linked to addiction. The most commonly abused substance by those who experience depression is alcohol, which is ironic because alcohol in itself is actually a depressant. The use of this substance may increase the feeling of sadness among individuals and strengthens the addiction that one has. Those who live with depression are twice as likely to develop an addiction than those who do not. I don't know if I said that right. Those who live with depression are twice as likely to develop an addiction than those who do not. It's been a long day. All right. So, how do we help our loved ones? Well, we can be optimistic, right? Hopeful. Be sure that we're conveying to our loved one that they have an illness and that recovery is absolutely possible. There will be setbacks along the way, but keeping a positive attitude can go an awful long way. Express your concern. For those experiencing addiction, it's important that they are aware that you are concerned about their well-being. These individuals may not always realize or acknowledge that they have a problem. So, shedding light on the fact that you're concerned for them can be a real eye-opener. Encourage them to seek help. Be sure to tell your loved ones that this is not something they need to try to tackle on their own. There are many people out there who can help them. There's programs, there's support systems, all kinds of stuff. So encourage them to enlist the help of a professional. Encourage them to build their support network. Set boundaries and stand by them. Although this may seem harsh, it's important that you set your limits for what you tolerate and do not deviate from these. That's part of self-care. These individuals may not change unless they notice the consequences of their behavior. So we must stand firm. Addiction is not only hard on those experiencing the addiction, but also on those who are surrounded by it as well. So you must take care of yourself too. Very important. Do not judge. Be aware of your comments and be patient with the individual. Try not to nag, try not to criticize or lecture or call the person names. They're experiencing addiction and need your support. Finally, always remember that the addiction is an illness and not a choice. Recovery can be possible for those who want it. So remember, you can't go back and make a new beginning, but you can start today and make a new ending. Stay positive, stay focused, and stay strong. So, asking for help. Where are the community resources for addiction? Well, there's the three numbers are right here. So Portage Atlantic, they deal with the youth addictions. They're just down, I think, from Elgin, Sussex region. They're just down that way. So yeah, they help with youth. And then there's Narcotics Anonymous. There's their toll-free number, and then the Gambling Helpline. And of course, we always have CMHA that's there to support. Also, they have a toll-free number and are always very willing to help and show you the resources that are available in your community. And of course, CMHA will certainly do likewise too. We're always there to support and help you find and get set up the resources that you need to move forward. And then mental health services themselves. We have local mental health professionals within all the communities throughout the province. We have peer support consultants. We have a mental health mobile crisis unit. They usually work from mid-afternoon till later evening. They're there to help out people who are in crisis. We have local mental health and addiction centers right throughout the province. There's 7 or 8 of them, I believe. There's the CMHA line, their number. Kids Help Phone, we love putting that up there because I think it's important that children be able to have access to that number. Of course, there's family and friends and 911 emergency, and of course, there's always your local hospital. And that's important to remember that they're there to support. So that kind of takes us to the end. So I'm just going to go up here and look at some of the comments. Is it true that you can never be quite completely cured of an addiction? Well, Sheena, here's what I'm going to answer to that. I had an aunt, and I say had because she passed, but she had been an alcoholic. She was an alcoholic. That's how she used to say it. I am an alcoholic. But she had been dry for, I'm going to say, 30, 40 years. But she would, you know, if offered a drink in a social situation by somebody who didn't know, if they offered it, she'd say, no, thank you, I'm an alcoholic. Because she knew that if she ever tried it again, took a sip, that's all it would take, and she'd be back there again. So I think you can cure from the effects of it and how it changes your mind and everything else, and the struggles that you'll have and the hardships that you'll have and the health issues that you'll have. I think you can cure yourself from that, but I don't think it ever goes away completely. I think the addiction really kind of stays with you. Can we have any attestation of presence? Thanks. I'm not quite sure what you're asking there. I imagine during this time, more individuals are using more substances such as alcohol, which can lead to addiction. Sheena, a very good point you brought up there. I have been in touch with a couple of the mental health clinics, and in as much as mental health issues have not really risen, there is certainly a rise in the addictions end of it. People are dealing more with addictions, and it could be for a variety of people. What do you think of a person of AA for mid-age person? What do you think of AA? I think AA is good for anybody. Can you explain again the double comment on about the fourth last slide? What we mean by that is a person with depression is looking for a way to maybe try to feel better, and they will turn to alcohol more. A lot of it too is because they're living in secrecy. They're living behind closed doors because they're dealing with withdrawal and that kind of stuff. So they're pulling themselves away from society. It's easier for them to hide and to turn to alcohol, to numb, to try to forget for a while what the issues are and what's making them sad and feel down and all that kind of stuff. So what happens is, because it does provide that relief, albeit short term, they'll continue to use it and then eventually begin to abuse it. One of the things that I do explain to youth when I'm talking to youth in the high school situations is it's very important that they give consideration before they start using and abusing drugs and alcohol. When we stop and think, when we're first conceived, our brain starts to develop from the back of the brain and works our way to the front, and it takes 24 years to completely develop. When you start abusing alcohol and drugs, the damage that they do to your brain begins in the front and works its way backwards. And that's permanent damage. So at some point, depending on how much you're abusing it, the development of the brain will hit the damage to the brain, and the brain no longer continues to develop. So it hits a wall, and then that's it. That development is gone as far as it's going to go. So I think it's very important that youth, and I really try hard to give them that message. I tell them, I'm not here to preach to you about drugs and alcohol. You're all old enough. If you're old enough to be dabbling in it and to trying it and everything else, you're old enough to be making those decisions and dealing with the consequences of those decisions. So you're old enough to be responsible for your own physical and mental health. And this is where we talk about that. So hopefully, you know, it's made a difference for some, but that remains to be seen. You know, all we can do is keep trying and keep educating and keep supporting and doing everything that we can do. It seems like some people drink daily and substantially just for the good feeling from it, short term, however. Exactly. And then that's what, when you're sitting back and you're saying, okay, well, you know, is it an addiction? If you need to be drinking every day, if it's not an addiction, it's soon going to become an addiction, because you're going to get to that point where you're not going to be able to, you know, to stop and to not have alcohol on a day, because your body's looking for that. It becomes a habit, and it becomes a need. You know, if you stop and think of the solid line. Okay, so we've got the continuum here, and this would be normal for you. This is when you're feeling normal. So you're here and you try drugs for the first time and you get a nice little high. And it feels great and it's fun and you really enjoyed it. And then you come back down. See where my hand is? Just on the other side of feeling normal. So a week later, you decide to try it again because you really like that feeling. So this time you have it and you don't go quite as high as you did before. But then when you come down this time, you're coming down even further back. And that's what happens to eventually, when it's an addiction, you need to use just to try to feel normal. Because it just keeps moving back further and further and further. You don't get as high, so you're maybe using more, or you switch to stronger. Okay? So that's how it happens. That's how an addiction can grow from something seemingly not very dangerous or not very threatening. But if you allow it to continue and allow it to get out of hand, that's what happens. It goes in that direction. When you say alcohol is a depressant, what do you mean? Is it like your explanation of coming back to normal? Well, alcohol is an actual depressant. It actually depresses your system. It slows everything down. It calms everything down. It relaxes you. Okay, that's why they say don't drink and drive, because your responses aren't as quick. You can't hit the brake as quickly. You can't steer as quickly to avoid something. Everything slows down and calms down. It depresses our system. So if you're already dealing with depression and then you use and abuse alcohol on top of that, you're furthering your depression. So that's, you know, your mood will be depressed even more. And of course, my contact information is there once again. So Denise Miller, that's my email address at gnb.ca, and my office phone number. I do check my voicemails at work. And then of course there's our website, Facebook, Instagram, and of course we're on YouTube. We have some other really great presentations on YouTube, so if you haven't been able to get there to see them, please check them out. Anxiety, depression, stress, work-life balance, mental health in the workplace. There's all kinds of great presentations on there, so you really should try to check those out. So yeah, okay, well, oh, just a second now, we might have one more. Okay, so yeah, so I'm now going to close down the webinar. So if you please don't mind, I'd ask you to stay on and to do the survey at the end. It's just, like I said, a brief survey. It's not anything complicated, just a very few questions, and take you just a few seconds. And we really appreciate the feedback. So have yourselves a very kind evening, and enjoy your weekend coming. Bye for now.